Welcome to Communication and Relationship Management. The objectives for this week are to explain the importance of effective verbal and nonverbal communication, identify clear and concise communication, identify the components of communication being the sender, receiver, and the message, recognize the value of attentive listening, provide and receive constructive feedback, explain ways to manage conflict, explain relationship management, and explain the significance of emotional intelligence for effective communicating. The elements of effective communication include when the receiver receives and understands the message as the sender intended. The sender is the producer of the message. The receiver is the one who is given the message produced by the sender. And feedback is the critical assessment of information or action. A key component of communication is the receiver's ability to hear accurately what the sender is saying. This depends on whether the receiver is practicing active listening, which is essential for a manager to communicate effectively. The manager or the sender should check with the receiver to make certain the message is accurately received. One method is to summarize the information and ask if this summary is accurate. Furthermore, the manager needs to let the receiver respond. Both parties, sender and receiver, should be willing to listen. The challenge of an effective communication process is understanding how to speak and listen well. Effective listening skills are a critical competency for healthcare executives. Healthcare managers who listen well are not merely waiting for their turn to speak in the conversation. They ask a lot of questions, they ask clarifying questions, they restate the answers, keep an open mind, are receptive to bad news, minimize interruptions, seek suggestions, and involve others in the conversation. Active listening may not always create effective rapport or provide the answer to a problem, but adopting active listening skills will certainly secure an advantage. Moreover, the additional showing of respect for each other is key for effective outcomes from the conversation. Managers communicate with a variety of groups and individuals. Within the organization, managers interact with their bosses, their colleagues, and their staff. And the staff expect their managers to share pertinent organizational information and to explain how that information will affect their work efforts. Communication flows may be downward, or lateral, or upward. Downward communication is primarily informational and initiated by the superior in the organization. Such communications are not solely face-to-face interaction. An email or text message that explains a clinic's vacation policy guidelines is an example of this form. Upward communication primarily lets managers know about staff issues. Face-to-face communication in the form of open meetings to discuss employees' concerns, open door policies, and walking the halls help create effective forums for this type of communication. Moreover, e-communication methods may also be effective, such as employee responses to a survey via SurveyMonkey. Lateral communication usually focuses on work processes. A frequent topic among colleagues of the same status is how to provide care that is more efficient, more customer-friendly, and more patient-centered. When lateral communication pertains to work functions, it may lead to positive outcomes in workload and efficiencies. However, lateral communication may also have negative consequences. Staff members who manipulate information for their own advantage or who offer misinformation may cause conflicts among other staff members. So managers should identify and deal with these conflicts to address such negative outcomes. Written communication is very important for healthcare executives, which is why on your assignments there's such a high emphasis placed on grammar, writing style, sentence structure, punctuation. Um, Letters, memos, reports, and PowerPoint presentations are central to the healthcare business. So effective written communication is important as it is relatively permanent, retrievable, and at times legally binding. Accuracy, truthfulness, and purposefulness convey the facts and provide the reader with truthful and useful information. Clear, organized, complete, and appropriately targeted writing helps the reader understand the information. Effective communication includes accepting the responsibility to hone one's writing skills. The healthcare manager should be able to write well, and you can improve with proper training. Writers should know who the reader is and how well the reader knows the subject matter. And then that helps you to select the writing style and determine what information to include. If the audience is your primary team, an informal style may be appropriate. The amount of background material and level of detail will vary according to the audience. Sometimes, no matter how hard you try to communicate effectively, you cannot completely avoid conflict. Relationship management focuses on the ongoing connection between you, your workplace, and the stakeholders. So employing effective communication and understanding that when we are communicating, we should treat others with respect and civility, they are important for a positive relationship management. Conflict is everywhere, at home, in the government, in your community, and at work. And while conflict may be unpleasant, it is not always bad. It can be a positive force in an organization. Conflict fuels creativity and innovation, maintains stimulation and activation, contributes to adaptation and innovation, and can call attention to problem areas, thereby leading to a search for solutions and improvements. Still, conflict is something most of us avoid when possible. It is stressful and time-consuming. It can be perceived as destructive, a hindrance to performance, disruptive to teamwork, irrelevant to tasks, and harmful to relationships among coworkers. Whether conflict is good or evil, it is bound to happen in an organization, and managers spend a significant amount of their time dealing with it. It's important to understand conflict and your instincts in dealing with it, and to have a framework for the better management of conflicts at work. There are two primary sources of conflict in the workplace: relationship and task. Relationship conflict refers to tension, animosity, and annoyance among coworkers. It is often unrelated to work and is interpersonal in nature. Task conflict describes disagreements among coworkers about the task being performed. Aspects of task conflict include disagreements regarding goals and competition or dependencies among coworkers, departments, or workers assigned to a team. Task conflict in healthcare often centers on differences in approaches to work, philosophies of care, or priorities and desired outcomes. Task and relationship conflict are easily intertwined. When working with a coworker whom one does not like, it is often hard to agree on what needs to be done and how to accomplish it. Conversely, when one disagrees with a coworker about a task or desired goal, it is easy to see annoying habits and negative characteristics in that coworker. Regardless of the source of conflict, the options for responding to it can be categorized into 5 general styles. The name of the 5 styles vary, but they're characterized by depth of concern for one's stance in the conflict and for the other party's stance. First one is the dominating style, which has high concern for self and low concern for others. Dominating refers to demanding and imposing one's will on others with little or no concern about the impact on the other party. The accommodating style demonstrates low concern for one's own position in the conflict and high concern for those of others. One example of accommodating is a situation in which you have no strong feelings one way or the other, but because the situation is important to the other party, you simply go along with the other party's wishes. Or it could be a situation in which you do not wish to assert yourself, even though you do care about the conflict situation, and you simply submit to the other's wishes. The avoidance style has low concern for self and low concern for others, and often presents itself as withdrawal or lack of cooperation. One example of this style is when the conflict is of so little importance to you and you have so little concern about the other party that you choose to ignore it. Avoidance, however, can be more malicious than just ignoring a problem. It can be passive-aggressive and highly uncooperative. It can be an attempt to control others not by what you do, but by what you don't do. The compromising style demonstrates a reasonable level of concern for self and for others. This orientation is concerned about keeping both sides equal and will attempt to match concessions, make conditional promises or threats, and actively search for the middle ground. The goal in compromising is to ensure that one side doesn't give in more than the other. Both sides do their part and give equally to resolve the conflict. And finally, the problem-solving style, which demonstrates high concern for self and high concern for others. It does more than search for the middle ground. It actively works toward finding the best possible outcome for all parties. It is assertive and cooperative. Which conflict management style to use depends on the situation and which style is more likely to help with resolution. It's affected by power, criticality, and confrontation. Power being the ability to enact one's own will based on status, rank, knowledge, level of education, reputation, or a combination of these and other factors. Criticality is the ultimate importance of an issue, the material effect upon the individuals, and the time pressure that might be involved in resolving the conflict. And then confrontation, assertive versus aggressive. Some basic guidelines can help with those who struggle to be assertive. It helps them to demonstrate greater confidence. And also it helps to prevent those who are naturally assertive from crossing over into aggressiveness. First is, don't try to place blame. It only polarizes the participants. Don't surprise either party with confrontations for which they are not prepared. Don't attack sensitive areas that have nothing to do with the conflict at hand. Don't argue aimlessly. Identify areas of mutual agreement. Emphasize mutual benefits to both parties. Don't jump to conclusions or solutions too quickly. Encourage both sides to examine their own biases and feelings. The concept of emotional intelligence was introduced by psychologist and journalist Daniel Goleman, who proposed that you should learn how to master not only the ability to manage relationships with others, but also to manage yourself. Your future success as a healthcare manager depends on this. You can hone these abilities by developing your self-awareness, self-regulation, motivation, empathy, and social skills. While it is imperative that you learn all the materials and tools associated with the healthcare industry, such as how to construct budgets, it's also essential that you learn emotional intelligence, which will help you to better respect others and earn respect for yourself. All factors that will help you perform well as a healthcare manager. There are 12 elements of emotional intelligence. Emotional self-awareness, achievement orientation, positive outlook, organizational awareness, coach and mentor, inspiration leadership, emotional self-control, adaptability, empathy, influence, conflict management, and teamwork. Points to remember. Communicating with others requires constant attention to the present interaction. Active listening is an important component for effective communication, and written communication is important as it is relatively permanent, retrievable, and at times legally binding. Relationship management focuses on the ongoing connection between you and your workplace and its stakeholders. Employing effective communications and understanding that when we are communicating, we should treat others with respect and civility. Those are important factors for positive relationship management. When handling conflict, consider the dimensions of power, criticality, and confrontation. And finally, understand that how you treat people at work and outside of work matters.